Funding for this edition of Life and Living with Joanna Gagis has been provided by Investors Bank, NJIT, New Jersey Institute of Technology, Health Republic Insurance Company of New Jersey, Celgene Corporation, committed to improving the lives of patients worldwide, PSE&G, committed to improving New Jersey's economy and strengthening its communities, NJM, auto insurance, homeowners insurance, and more, with a focus on safety and financial stability, and by the Russell Berry Foundation.
Welcome to a special edition of Life and Living. I'm Joanna Gagis. I'm coming to you live from the Liberty Science Center, where today we're going inside the operating room to learn about and witness a live kidney transplant. Now, for those of you who are thinking now is a good time to change the channel, don't, because this next half hour will show you why this procedure is so critically important and how the shortage of organs in New Jersey has left over 5,000 people waiting for this life-saving miracle. Dr. Geffner, how did the Live From project start?
About 10 years ago, a little over 10 years ago, the Liberty Science Center approached the New Jersey Organ and Tissue Sharing Network about the possibility of expanding a project that they'd already done with cardiac surgery to include live transplant surgery. And at that point, the three of us, St. Barnabas Medical Center, Liberty Science Center, and the New Jersey Organ and Tissue Sharing Network got together and developed this program to be able to essentially broadcast live transplant surgery to high school students.
What is the goal of the program?
A couple of goals of the program. One is obviously to enhance the science education of high school students in the area. The second is really from our standpoint, from the standpoint of my transplant program, from the standpoint of the New Jersey Organ and Tissue Sharing Network, to really increase the knowledge of the need for organ donation and the issues surrounding organ donation.
Joe, what is the New Jersey Sharing Network and what is its mission?
Well, our mission is to save and enhance lives through organ donation and transplantation. The Sharing Network is an organ procurement organization chartered by the federal government. We service most of New Jersey, identify potential organ donors, and facilitate the donation of those organs and then the allocation of those organs to the transplant centers. Under federal law, every hospital in the country, what we call an acute care hospital, must affiliate with their local organ procurement organization and follow certain procedures to notify that organization of any potential organ donors so that we can evaluate them for the donation potential. So it's actually, they call us with every death or imminent death. Usually it's an imminent death as a patient on a ventilator who has a non-survivable injury. And then we have highly trained staff who go to the hospital, evaluate the chart, and decide whether that patient may or may not move forward to possible donation.
Why did the Liberty Science Center see value in bringing students into the operating room?
We've been doing this Live From program for 13 years, and the kidney transplant is the one that we're doing with Dr. Geffner at St. Barnabas. It's an amazing program to see an actual kidney transplant, real, and to watch that transplanted kidney suddenly become alive as it's infused with blood. It does so many things for these kids. Obviously, it teaches them some about anatomy and medicine. There's psychological and social issues involved. Sometimes we have the donor in the room explaining to the kids what it was like to make that decision to donate one of your kidneys. And of course, it's something we're trying to raise an awareness of with the Sharing Network. There are 120,000 people in the United States that are on a waiting list for life-saving organ transplants. 18 people die a day because there aren't enough organs available.
Good morning, my name is Renee Harris, and I have to tell you, I'm so excited to have you all here today, and I'm also so excited for what you get to experience today. I am what is called an altruistic kidney donor. An altruistic donor is someone who donates a kidney to a stranger. I didn't know a whole lot about this until about 3 years ago. My youngest daughter, who lives out at UCLA, she started doing her research on this, and I started getting kind of interested. And in June of 2012, she donated a kidney out at UCLA to a stranger. So I went out with her when she did hers at UCLA. I had the opportunity to meet the recipient's family. which is unusual. The family and myself happened to be in the same waiting room, which is unusual, and I heard them talking about kidney. And finally I interrupted and I said, would you mind if I said, I don't want to intrude, but you know somebody who's having kidney surgery? And they said yes. Their son was receiving a kidney from a 39-year-old angel. And they went on to talk about how unusual and what a miracle was that all of a sudden this angel came out of no place to donate this kidney to their son, who was 26 years old. And I started getting tears in my eyes. And finally I couldn't hold back, and I said, I believe that's my daughter who's doing this. So we had this wonderful bonding experience. I would have donated my kidney anyway, even without this, but to see how it impacted the family as well as a patient was so significant in really my decision.
I'm here with Renee Harris, who is the oldest living donor here in New Jersey, but also in the country. Is that right?
Out of 100 hospitals that are on the registry, I'm the oldest in the country.
What was your experience after having the surgery and after giving the kidney? What did you feel went well, and what did you feel was maybe missing?
The thing that went so well was that I was okay. The recipient, because I'm an altruistic donor, I don't know who the recipient is, and I knew that going in. And I also heard that the recipient was doing well, and that was the best. That was the best. I also knew that how much it meant to the family. Myself, I felt a loss, an emptiness, because I didn't have a family, a relative, a friend that was there with me, that was connected with this whole process. And so with that void, I contacted the New Jersey Sharing Network because I read their mission, and they were involved in getting out there and giving information to the public as to the need for donations, not just kidney donations, but other organ donations, and how to do it. When I was going through the process of being tested and everything, I found that a lot of people didn't know anything about the need for organs, or there was such a thing as altruistic donors. And so I knew that there was a need, and I found that is what is really continuing the life of the whole donation, is educating people to the need, and that people can do it.
That's what really gives meaning to it.
Yes.
Why did you choose kidney transplantation for this project?
Other organ donations and other transplants are not elective. They're emergency. They happen anytime, day or night. So in order to develop this program, we needed something scheduled. So that's why we chose to do it with living donor kidney transplants.
What do you hope is the biggest takeaway for the students?
A couple of things. One is obviously we want to encourage them to further their education, work hard, study hard, do the best they can. Hopefully we're impacting them in some way to maybe look towards a career in science, if not necessarily becoming a physician. We also show them what nurses do in the operating room, talk about other fields in medicine that are open to them. So that's one aspect of it. And obviously the other aspect is to increase the awareness about organ donation. Each year we put many, many more people on the waiting list to receive life-saving organs, be it kidney, heart, liver, lung. Each year we place more people on that waiting list than we have available donor organs. And one of the biggest constraints with regard to the number of available donor organs we have is the issue of consent. So of all medically suitable organ donors in the state of New Jersey, we're able to obtain consent about 60 to 65% of the time. So if we could increase that consent rate, and that consent rate comes from people's knowledge about the situation, knowledge about the problem, and to some degree, allaying fears or ideas that are not necessarily true about the process of organ donation. If we can increase people's awareness and knowledge, then perhaps we can increase those consent rates, obtain more donor organs, and really save more lives.
This is Gwen Anderson, who received a kidney transplant in 2010. Gwen, what was your life like while you were waiting for a kidney?
Getting up at 3:30 in the morning, waiting for my transportation 3 times a week to go to dialysis. And that went on for about 6 years.
What is that process like? And for people who will never understand what kidney failure and dialysis is like, explain it for us.
Well, let's put it like this, it's not a game. Because once you get on that machine, you have to keep yourself very healthy. And because that machine will kill you. If you're not healthy and you don't take care of yourself while you're on that machine, you're gonna get very sick.
How did your life change when you received a kidney?
Honey, it was a new lease on life completely.
What do you know about your kidney donor?
I didn't know anything about her until about 3 years ago. Because once you get a transplant, they don't tell you who the person was, where it came from, or anything like that, unless the family requests to meet the donors.
To meet the recipients?
To meet the recipient of the person. And the Sharing Network called me and told me that Jackie Larea wanted to meet me. And I was so happy because I had been praying about it, because I really wanted to meet the person that I had their mother or father's kidney.
What is your relationship with Jackie like now, and why is that relationship so significant considering what you both have been through?
Actually, it's just like I gained a sister, although I have a sister, but this sister is altogether different, because we have a tie that nobody else could share with us, because I have a part of her mother, and every time, I guess, when she looks at me, she sees her mother, and it makes you feel good. It really does.
What is your life like now?
Great, absolutely. Because if it went for Jackie's mother, I wouldn't be here today.
How would you respond to the concern that a patient may not be operated on the same way or given the same kind of care if they became an organ donor?
That is absolutely not true. In New Jersey or anywhere in the United States, patients are taken care of really to the maximum of our capability. It is only at a time when a patient cannot be recovered, if they've suffered severe neurologic injury from which they cannot recover, or if they've suffered what's referred to as brain death, where there is no longer any brain function. Only at that time does organ donation become an issue and a question. So patients are taken care of to the absolute maximum capability of whatever healthcare facility they're in, but only at a time when the patient can't be recovered does organ donation come into play.
If a donor is deceased, would you still go in laparoscopically, or would it not make a difference?
No, good question. It's an entirely different surgery. So if a donor is deceased, we remove both kidneys, and frequently, obviously, the liver, perhaps the heart, lungs, pancreas. So that's a different type of operation entirely.
What are some of the common questions that you get from the students?
The students will ask really anything. It can be simple things that they just see on the screen. Why is that bleeding? Why is that not bleeding? Sometimes when we cauterize something, they might see a little bit of vapor, so they'll ask, is that smoke? And then they'll ask questions like, have you ever dropped the kidney? There are times when we carry the kidney from one room to the next room.
And the answer to that is?
No, we have not. Fortunately, they don't ask what I would do if I dropped the kidney. But so they ask really a wide variety of things. Some of the kids are really, very, very knowledgeable and have had some preparation prior to coming to the Science Center. So they might ask very advanced questions about immunology, about the future transplantation, about stem cells, things like that. So sometimes they stump me too.
Do you ever find it difficult to concentrate when you're responding to student questions while operating on a patient?
No, and that is actually the most frequently asked question. In order to do this, we need consent from patients, and that's really the most common thing that patients ask me. And the answer to that is really no, and the reason is that this is what I do every day. We have a very large center, one of the busiest centers in the United States. We do this almost every day. And on any given day in the operating room, I may have medical students, my residents, so there's always some discussion, questions, answers. Things are always going on in an operating room. So today I eliminate all those things to talk with the high school students, but in no way is it distracting to me to be talking with them.
In our hands, we are extremely experienced with what you're seeing us do today. So we do everything we can to maximize the safety of the patient and maximize the outcome.
Jennifer, you brought a class here today. What class was it?
This was my Human Anatomy and Physiology elective class.
Why did you bring them here today?
For a few reasons. First, I think it's important that they get to see real medical professionals. working in the field, because it's something that will help them inform their careers in the future. And these students are students who are taking this elective because they're interested in the human body. So I have a good group in that sense, that they are interested in this field, and a lot of them are going into medicine in the future. Secondly, I think it's important for them to talk about donations. Not something we talk about a lot in our curriculum. We've had a few class discussions about it, but I thought it was important for them to see this surgery specifically for that reason, because of the number of people that are waiting for donations, and the fact that these are upperclassmen who are going to be making these decisions in the future, in the near future, about what they want to do in terms of being donors.
And no thought for whether or not they can handle this? I mean, you're confident that your group can come to an event like this and handle it?
Yeah, I think that we've done some dissections in the classroom already, so they're pretty comfortable with that kind of thing, and obviously they knew what they were getting into. We did prep them before we came about what they would be seeing. So there were a few students who decided not to come, but for the most part, the kids that were here really wanted to get the experience.
What do you think was the biggest takeaway for them?
For these students specifically who are interested in medicine, it was good for them to see something go from beginning to end, in terms of when they took the kidney out of the donor and then it changes colors. It's very visual, so it was something they could see, really medicine at work. And also just the donor program, and hearing from the speaker beforehand, and kind of getting that experience about not just becoming a donor on your license when something might happen to you, but also an altruistic donor. I think that's a side of things that we don't talk about much.
What have you seen as some of the outcomes of this Live From program?
Well, we've actually seen students who have come to us later on and in actual donation situations, and said that they saw this in Live From, and we feel that this is the right thing to do. And they've helped their families make the decision to donate under tragic circumstances, to donate their loved one's organs, save somebody else's life.
What did you enjoy the most about today?
I think although I really enjoyed the surgery, I really enjoyed the speaker who came out to talk to us. She was this 7-year-old woman. She was so powerful because she donated her kidney to someone who she doesn't even know, and she still hasn't even spoken to them. But what I thought that was most powerful was the fact that you can do something and totally change another person's life and not even know who they are.
How did that impact you in terms of what you're going to do when you leave here today?
I was always interested in becoming a donor, and now it's pretty much, I'm confident I'm going to become a donor, seeing how much you can change a person's life whether you know them or not. So.
She said that a challenge for her was not having the support of the people around her. If you found that the people around you weren't supportive, how do you think you would handle that?
I'm fortunate enough to usually have the support of my family behind me, but if it happened that I didn't, I think, I'd be doing this for myself, and I'd be doing this for a different person, and I think I'd find the confidence within me to progress and still do it.
So you're pretty sparked about this, pretty passionate right now.
Yeah.
And what about the surgery? What impressed you the most about that?
The doctor's composure is pretty impressive, because the fact that he can multitask like that, but I really enjoyed when he was cleaning off the kidney, how just trimming the fat and then also sewing it up. It just might be me, but I thought it was pretty cool.
I thought it was pretty cool too. Pretty impressive what they can do with such tiny utensils. In fact, when you hold it up and you realize that it's only as big as that, it's pretty impressive.
Yeah, his sewing skills are, I can't even put on a button.
He probably got an A in home economics.
Probably.
What does it do for you coming here today and addressing a group of high school students?
I love talking to high school students. It is absolutely the best. They're open, they're receptive. I identify with high school students. I have grandchildren that are in high school, and I just identify with them and their openness to new things, and they really are going to be the agents of the future, and I like sharing this part of my life with them.
Why should people donate?
There's a need, and they can. It's not for everybody, but there are people out there that can do it, and they just don't know it yet. I didn't know it. Now I know it.
What was the most impactful thing you learned today?
I guess it would be that there's a lot of need for organ transplants, and it's not a difficult thing, and it's not as scary as I thought it would be.
Did you think that was scary?
after seeing it, it's not that scary, but before I was kind of controversial about it. It seemed like it would be a more intensive procedure, but generally speaking, I would say it looked simple, I guess.
As simple as an organ transplant can be. How unique of an opportunity is this for these students?
It's totally unique. And the kids learn so much from it. I mean, it's transformative. We've had kids that have been there, because again, it's a 13-year-old program. We had 2 kids from Union City who were getting Fs, and one was in a gang, quite literally. They watched that program, and today they're almost finished with college, they're getting straight A's, they're going on to medical school. The surgeon they saw there continues to mentor them, calling up every 3 or 4 months to make sure that they're doing well. So it's very transformative, this program.
What does that mean for you when you hear a success story like that and you know that the Liberty Science Center was a part of that?
I mean, I love it. I mean, that's our mission, really, to get learners of all ages, but particularly kids, excited about science, the power, the promise, and the pure fun of science. And then our secondary mission is to get kids to take up careers in science, technology, math, engineering, all those subjects. Because right now, there's a crisis in this country where we're not graduating enough kids with the scientific and technological chops to fill the jobs we need. And this is an issue not just that I like science and there should be scientists, it's an issue of economic independence for the United States. And if we're to maintain our edge in innovation, we need more people going in this field. It starts by getting kids excited. Luckily, there's a lot of civic-minded companies and foundations that are interested in making a difference with kids in New Jersey. Investors Bank is one of them. They're one of our supporters of the Live From program. And obviously the Sharing Network too. I mean, here the Sharing Network and Liberty Science Center have a common mission, and that's both of us understand the need for more people donating organs. I mean, 18 people dying a day because there aren't organs available is kind of sad. So if we can make a difference in changing that, we want to do that.
What are you going to take away from today, and what are you going to share with people when they ask you what you learned?
Well, I'm actually an EMT back home, and I actually told some of my supervisors that I was going to this, and they were just like, you get to see the other side after you bring the patient in. You should really think about this, because you never get to see like what happens after you leave a patient, and some patients really need this, and this is just a life-saving surgery.
So is a career in the medical field in the future for you?
Yeah, I'm actually going to nursing school next fall, so yeah.
Joe, for you, what's the most rewarding part of this job?
Coming to work every day, working with the people I work with, knowing that every day we're trying to save lives. I've been doing this for 16 years now, and I can't imagine doing anything else. It's the most rewarding, satisfying job I've ever had. And I meet people every day who we've impacted in some way or another, either through actually identifying an organ donor and recovering organs that help save their life, or help import an organ that helps save their life. So just an amazing, amazing, amazing experience.
Life and Living has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and NJTV. Funding for this edition of Life and Living with Joanna Gagis has been provided by Investors Bank, NJIT, Health Republic Insurance Company of New Jersey, Celgene Corporation, PSE&G, NJM, and by the Russell Berry Foundation. Promotional support provided by The Record, North Jersey's trusted source, and NorthJersey.com, and by Commerce Magazine.